Dr. Amaka. Always looking fabulous.
Thank you.
So let's talk breast cancer.
Okay.
What are the earliest signs of breast cancer in women?
Okay, so before I start talking about the earliest signs of breast cancer in women, because I know that this is a diverse crowd, let's
Yeah.
first of all understand what we mean by cancer.
Cancer. Okay.
So, cancer in a nutshell, I'd say, is uncontrolled and abnormal growth of cells, which can metastasize, go from one place to the other, and affect the organs and the body at large. So, if we come at it from that perspective as an uncontrolled and abnormal growth of cells, you find out that the earliest sign or symptom of breast cancer is a lump in the breast. So many times, which is why we typically advocate for women to be familiar with their breasts, or what we call breast awareness, from as early as in your 20s, really. You become familiar with your breast, you do the self-breast examination, and then you also go on to see the healthcare worker who will do a clinical breast exam, ideally once every 3 years. And then thereafter, you have imaging for those that are old enough, from 40 and above. We recommend mammogram as well as a breast ultrasound. So all of these things are geared towards picking up the breast lump, which is the commonest symptom in the breast. But having said that, I'd also be quick to point out that there are some types of breast cancer that present not with a lump, but with the change in the skin. And which is why for some, they go to the hospital and they ask, what is the texture of the skin? Sometimes it can be like an orange peel, and they may have missed the breast lump, but then they present with that orange scale appearance. And then there's also something we call inflammatory breast cancer, which is just around the nipple area, and it's kind of like reddish. So, but in the basic form, most times they will present with a breast lump, not necessarily a breast discharge, but typically a breast lump would be the earliest signs.
All right. Could you walk us through the different stages? We gather the stage 1, stage 2, stage 3, and stage 4.
Yeah, so when a doctor talks to you about stages of cancer, whether breast, prostate, or anything, what they are trying to do is to give an idea or let you know how extensive the lesion is. So when we say that is stage 1, it's typically really small. Same thing with stage 2. And then when you hear that it's gone on to stage 3, what we call locally advanced, which means it typically may not just be within the breast. For instance, if we're talking about breast cancer, because we use based on size, but then it has gone to other areas like the lymph nodes, like I said, abnormal growth of cells, which can go from leave where it is and go to other places. And then when you hear stage 4, this is what we call distant metastasis, in which case it has now entered the bloodstream and has gone to other places, aside from just the local spread or the regional spread, which is the lymph nodes, but now to other organs in the body.
Interesting. So, what exactly causes breast cancer?
That's $1 million question. So it's not like, I usually say that it's not like malaria, where everybody knows that with a mosquito bite, you increase your chances and you have breast malaria. For breast cancer, what we talk about is risk factors. What are the things that predispose a woman to having breast cancer? And so we know that genetics plays a huge role in the development of breast cancer. So when you come to the hospital, we would ask, do you have what we call a first degree relative who has breast cancer, meaning your mom, sister, aunt. So if you have somebody that close with having breast, who has had a diagnosis of breast cancer, that automatically increases your risk of having breast cancer. It doesn't say that you will, but it means that you need to be more regular on your checkups. Same thing also will say that other risk factors that have been ascertained by research will include what we say is having a wide estrogen window. So you have a woman who has a young girl who starts her menstrual cycle early, and then her menopause is late. So we call it a wide estrogen window because the woman has had several months, years menstruation, the estrogen going up and down, and all of that. So we say that, and which is why, again, when we talk about the estrogen window, we talk about age at first birth. If you have had a child later than 30, if your first completed pregnancy is later than 30, it also increases the risk of having breast cancer. And if you have children and you don't breastfeed them for more than a year,